Do you have Achilles tendinitis or is it something else?
I'm Doc John.
I'm Dr. Chloe Costigan.
And we're from Mobility Doc, and we're going to get into how to tell if you have Achilles tendinitis and what we do to treat it. And we're going to show you, if you stay tuned, exactly how we treat it by having Dr. Chloe here, torture my calf, just kidding, treat my calf exactly how she would if you were here, so you could do the same thing from home.
We'll also get into a little bit of the anatomy, so kind of understanding exactly what Achilles tendinitis is, and then that's when I'll also go over what it is not, because really frequently we'll kind of think about some of this pain in this lower part of the calf and the upper part of the heel as being Achilles tendinitis, but it's really important to effectively treat it. You need to understand what it is and what it isn't.
And if you can't tell, we're going to deep dive, and for those of you who like to nerd out a little bit, we got Dr. Chloe in this video, so
I'm here for that.
Yeah, this is exactly what's about to happen. Yeah. Let's get into it.
Here is your Achilles tendon. Achilles tendinitis is when the tendon gets inflamed. The tendon typically gets inflamed right where the tendon attaches to the bone. Now, keep in mind that a tendon connects the bone to the muscle. So when we're talking about the Achilles tendon, we're talking about the tendon of the gastroc soleus. This is the gastroc. This is what we think of as the calf. So here are the two heads of the gastroc, and the soleus is deep set. You can see this kind of along the side, but if we take away this gastroc muscle, then you can see the soleus is underneath all of that. So what happens is if there's a shortening of this gastroc muscle, it starts to pull at that tendon, and then it starts pulling at the bone. So a lot of times where people will feel that pain is kind of in through here. But some of the source of the issue is coming from that whole gastroc soleus. One thing that's pretty interesting about this gastroc is that it actually crosses the knee joint. If we're looking now just at the bones, these two little red marks are where the gastroc attaches just behind the knee. So where we kind of typically think of the hamstring as being, the gastroc is all the way up there in that knee crease. So what we need to do is we need to make sure that this gastroc is flexible throughout the entire length of that muscle. This will be important when I get into the treatment part. Now, the thing is, they'll describe this Achilles tendinitis pain as, they'll say they have heel pain, and it really matters where it is. If you have pain in the bottom of the heel, you might have something else going on, or it can be kind of related to this Achilles. But typically this Achilles tendinitis is right at this bottom part of the tendon and then can extend up through here. If you have pain on the inside part of the ankle, by where this part that's called the medial malleolus, this like inner part of the ankle, you could have posterior tib tendinitis. Or if you have pain on this outside part of the ankle, you could have what's called peroneal tendinitis. So same idea of this type of tendinitis, but it's coming from a different muscle. So for this Achilles tendinitis, it's really important to kind of think about, okay, well, where is this location of the pain? So then that way you can effectively treat what it is that you need to. So you can have this pain when you have Achilles tendinitis that kind of goes all the way up through this part of your Achilles. And you can even actually begin to feel this right in what's called the musculotendinous junction. This is actually a pretty common site for a tear or a significant strain of the gastroc and the Achilles. So that's why it's really important to make sure that you address this Achilles tendinitis. So then that way this tendon doesn't get so irritated and pull so much that then it starts to create some structural instability at that musculotendinous junction. There's a difference between tendinitis and tendinosis. When tendinitis has kind of continued past the point of it just being an acute inflammation, you start to actually get histologic or tissue changes in the Achilles as well as in this musculotendinous junction. That's when you develop what's called tendinosis. So you had this chronic inflammation that created changes in the structure of the tissue. That's why some of these treatments will be really important, because what we're trying to do is we're trying to realign all of these fibers of the Achilles tendon and also increase the flexibility through this gastroc soleus. The inclination for Achilles tendinitis is to do some type of strengthening or stretching. So really frequently patients will say to me that they started doing calf raises because that's going to strengthen this gastroc soleus. And yes, that's part of the equation, but it's not the whole part of the equation. And what you need to do is you need to first focus on restoring the flexibility of this gastroc soleus, reducing the inflammation in the tendon in order to actually improve the strength. You can't only stretch, because what happens is with this stretching, you're just trying to stretch the fibers of that muscle and a little bit of the tendon. But the thing though is that what we actually need is we need to realign the fibers of the muscle and the tendon, which you can't do purely just by stretching. You need to do some of this soft tissue work that I'm going to show you, which will be helpful for helping to realign those fibers. We need all of these fibers going in this vertical motion, because what happens is when there's some of that inflammation, they get it's almost like they kind of start to get like a little cross and tangled. So we need to smooth everything out.
We're going to be using the Sidekick muscle scraping tool. We're going to link a video we made previously to help you to figure out which tool you would choose and how to choose it. We're also going to include a link to make it easier for you to purchase one if you need one. It is what we use here in our very office, and it really is what we found to be the best price points. Click on our link and you will also be supporting us and our mission to help as many people as possible.
All right, so let's orient ourselves here. Here is this Achilles, and then it comes up right until about there, kind of right in the center. That's that musculotendinous junction that I was talking about. Here's the lateral head, the medial head of the gastroc. So we want to make sure that when we're treating this, that we get through this entire length of the tendon as well as the muscle. Now, when you have Achilles tendinitis, what will happen a lot of times, especially when it's particularly inflamed to start, if I take this heel bone, this calcaneus, and I kind of start palpating around here, if I kind of start pressing a little bit, you might find that there's tenderness on this outer portion of the Achilles or this inner portion of the Achilles. In particular, a lot of times it's sore, can be painful through this inside part of the Achilles where it attaches. It is often the place where people get bone spurs. So what you'll actually see is that you'll get this thickening of the bone. That is a result of the fact that this tendon has pulled so much on the bone that the body responds by actually laying down more bone. It's like your body's like, hey, we need to stabilize this area. It's getting pulled way too much. And then you actually start to have more bony growth there. Now, what we need to do is we need to reduce the amount of inflammation so then that stops happening. Okay, so what you're going to start with doing first is you're going to do this cross friction massage. So I'm taking my thumb and my index finger and I'm coming on either side of this Achilles, right where it attaches to the bone. So you're going to be on a bony area. You're just going to press and you're going to move up and down as well as side to side, okay, for 1 minute each direction. Now, the pressure is just to your tolerance, okay, because I want you to do it. It's not this no pain, no gain, right? What we're trying to do is we're just trying to slowly introduce some range of motion to that area. Now, an important thing though, is that it's not like we're rubbing lotion in the muscle or in the tendon. What we're doing is you need to press down first and then you start moving. So I'm not doing this sliding back and forth over top of the muscle and the tendon. I'm pressing down and then I'm moving back and forth. You notice I'm moving up and down, but my finger isn't actually moving along that tendon. So that's what we're trying to do in this lower part of the Achilles. So I'm pressing down, so I'm pinning this down, the skin, and then I'm starting to move back and forth. So first I'm going vertically, then I can move side to side. That is what's going to be helpful for starting to get some of that connective tissue to move a little better and reorient those fibers of the muscle and the tendon. Then you can start to move your way up. So then I can kind of come on either side of the Achilles and I can do that same cross friction massage. So I'm just using this left hand just to stabilize where the heel is. And then I'm just moving up and down, and I'll repeat for 30 seconds to a minute. Then I'll move up a little bit and I'll do again 30 seconds to a minute. Just up and down, coming all the way through this part of the Achilles. Really frequently, it's particularly sore through this inside part of the Achilles. So what I'll even do then sometimes is I'll use my thumb and then my fingers will be on the other side of the heel. And then I'll just do this motion back and forth through this part of the Achilles. And I'm kind of even coming underneath it a little bit. That a lot of times is a particularly tough area to get to. Something like foam rolling isn't going to be as specific for getting to this area. That's why it's actually really helpful to do this self massage, this cross friction massage, because then you can use your fingers, which are much more discerning, to be able to get to that tendon to help to realign those fibers. Dr. John already went over some of this cross-friction massage, so make sure to check out that video for a little bit more detail. After doing the cross-friction massage, I like to then start to get a little bit deeper into the muscle. So I like to do some deep tissue massage. So it's kind of the same idea. So now I'm moving up through this part of the Achilles, kind of coming up into that musculotendinous junction in particular. So I'll press down and then I'll almost kind of start to like pull the muscle toward the outside, and then I'll kind of pull it toward that inside, kind of seeing where it feels the most tight. Like I had said in the anatomy portion, you have two heads of your gastroc, so you have this lateral head and this medial head. So what I like to do is I like to envision, I found a spot, I like to envision kind of coming right up through the center of those two heads, and it's like I'm almost trying to like pull it apart a little bit. So it's like I press and then I pull out to the side. Press, pull out to the side. Now, of course, this is a lot harder to do on yourself, but if you have that same idea of just thinking about, okay, I'm trying to influence the connective tissue of the muscle as well as the muscle fibers. So you need to press and then pull in some direction. The thing that's also important is making sure that you're not trying to move too much throughout the entire muscle. So if you're just kind of doing this big scan of, just kind of moving back and forth, you're never really going to be able to make an effective change. So take your time with this. You're going to kind of scan that area. So when I'm moving through this, I'm trying to find, okay, well, what's painful on me? What does it feel like if I move this direction versus that direction? The thing that's important though is don't just stay in the places that are painful. You're actually going to benefit yourself by making sure that you're moving throughout the entire length of the muscle and the tendon, because if you loosen up one part, then it's going to help with everything else moving a little bit better. Also, if something is particularly painful, it doesn't mean that you have to continue to try to just attack that area. What you can do instead is just move around it a little bit, and then as everything else starts to loosen up, then you'll probably find that you're going to be able to revisit that area. Okay. After the cross-friction massage and the deep tissue massage, I like to use the Sidekick tool to scrape through the muscle. We'll make sure to link the video of what instrument to choose and how to use it, so make sure to watch that. But the thing that I like to do after I've done the cross-friction massage and the deep tissue massage is go through and do some muscle scraping throughout this entire muscle and tendon. This does not feel good for him. Because he's moving. Okay, but I'm first starting with just the muscle belly. And now remember, like, this is not a no pain, no gain kind of thing. So I'm trying to be at least a little gentle. It's important to get through this entire muscle. Now, avoid the crease of the knee, but you want to come up all the way through this top part. Because remember, I said that the gastroc attaches just past the crease of the knee into the thigh, okay? So I'm kind of coming all along the side, the center, making sure, don't forget this inside part. I actually like to get to the soleus a little bit by bending the knee. Yes, he needs this through his soleus, is by bending the knee, because then I can kind of get the gastroc out of the way and get to the deeper part of the muscle. He very much needs this. I can feel that the Sidekick tool is kind of like vibrating back at me, especially in this inside part and through that center. Now, when I come in through this part of the Achilles, this is where you might want to let up some of that pressure, because again, we don't want to create even more inflammation in this lower portion. You might not be able to scrape in through this, in through the tendinous attachment of the Achilles into the bone, just because it's pretty inflamed. So stick with that cross-friction massage, stick with that deep tissue massage. That's what's going to be helpful for slowly getting this to move. But by working through this whole musculotendinous junction, through that muscle belly, it's going to help to reduce that inflammation that's on the tendon. Make sure to come along either side of the Achilles tendon. That's what I like about this Sidekick tool. Was before I was using the convex side, and then I'll kind of come to the concave side and come along either side of the tendon, because it kind of fills in the contour of the Achilles, and I'm coming through either portion here. I like to spend at least 2 minutes through the muscle belly itself and then come down in through that Achilles for about 1 minute to 2 minutes. The thing though that you want to make sure of is that you don't need to apply a ton of pressure to start. It's one of those things where your body's actually going to respond better if you gradually increase that pressure. It's not the sort of thing that it's like you're really pressing in and pulling. Bruising is not going to be an indication necessarily that you've had an effective treatment. So we went over the treatment parameters for a single session. Now, in terms of how often you should do this, you can do this every day, every other day. Let some of the soreness be your guide, okay? So if you're feeling kind of particularly sore the next day or later on in the day from some of that cross-friction massage and that deep tissue massage, then maybe you want to focus a little bit more of just doing some scraping through the muscle belly and then doing some stretching after. It doesn't necessarily mean that you have to get after this every single day. You can kind of go through this part of the Achilles every day or every other day, or also for each session, really just focus on, okay, I'm just doing this area for 1 minute and then I'm going to kind of come through everything else. So what's important is that you need consistency in this sort of thing. In order to create any type of change in the muscle and in the tendon, you need about 4 to 6 weeks, because what happens is that the tissue actually has to undergo a remodeling process. So you might feel like you're more loose just after that first session, but I describe it like this. When you're trying to create more space, it's like you can kind of declutter a room in your house, right? And it looks like it's a little bit more spacious, but what we're trying to do is we're actually trying to build an addition on your house, okay? That takes a little bit of time. So we need about 4 to 6 weeks or so to actually increase the resting length of the muscle, and then that's what's going to help to decrease that tension on the Achilles, and it's gonna stop pulling on the calcaneus. There's a lot of nuance when it comes to treating this. So I kind of gave you some general parameters, but know that a little bit of this is trial and error, right? So you need to collect some data. So try something for a few days, see how you're responding to it, and then you can adjust from there. As always, ask any questions though, because then we might be able to help to guide you a little bit better.
Yeah, just comment right below. Let us know what's working for you, or like Chloe said, any questions you might have. We'll continue to help guide you through this. I previously recorded a video on a few different ways that you can self-treat your Achilles tendon and, generally speaking, your calf. So
yeah, check that out. It's good.
Yeah, check that out as well. That's good.
It's good.
Oh, good.
Yeah.
Keep watching for more videos and watch the videos that we linked in, as well as click on the Sidekick link that we provided you, so that way you can get a look at the different tools that they have.
Ciao.
Thanks for watching.